Okay, so again, welcome everyone to the webinar on Doxim COVID-19 and Essential Service Delivery Update. My name is Janet Lucer. I'm the Vice President of Marketing and Customer Experience here at Doxim. So quickly, I'd like to review some logistics. During the webinar, you can submit your questions in the Q&A area of Zoom located at the bottom of your screen. If we have time at the end of the webinar, we will share these questions and open it up to a Q&A period. If we do not have time, we will follow up with you with your questions offline. At this time, I'd like to introduce our speaker, President and CEO of Doxim, Mike Rogalski. Mike joined Doxim in October of 2019 as software and services executive with a focus on delivering stellar client service and business growth in financial services and regulated industries. Mike joined Doxim from Epic, a worldwide provider of legal services helping financial institutions and government agencies, law firms, and corporations streamline the administration of business operations. He holds an undergraduate degree in accounting from the University of DePaul and an MBA from the University of Michigan. I'm pleased to turn the chair over to Mike.
Janet, thank you. And before I begin today, where it is my intent to give an overview as to what Doxim is doing to ensure we can serve you and share with you how we are keeping our associates and their families safe, I want to wish and hope that all of you are safe and healthy at this point as we operate in this unprecedented time. Up front, I do want to apologize if you hear any kids or pets in the background, as is part of our business continuity program or plan. We have many of our associates working from home. So I want to really just dive right in, and we have been authorized really and not even authorized, but it's been put out that we are an essential services provider and authorized to do work, I guess, by the US and Canadian government agencies. We are here to serve you. And when you think about the clients that we serve, both from a software and print mailing perspective, we serve companies in the financial sector, the energy sector, health. Apologize, just had a technical difficulty here. And when you think about the mail and delivery services, in many respects, what we are doing is working on behalf of the US and Canadian postal services. We are a vital service provider working as a business behind the business with all of you, ensuring that you can communicate with your respective customers, whatever vertical, financial, energy, healthcare, et cetera, you may be residing in. We have tried to err on the side of communicating, over communicating. It's why we wanted to have this call today. You should have received a note already from your account executive or customer services manager or somebody in marketing notifying you that we have been authorized or deemed an essential services provider. We are focused on supporting our clients. We know we're key to helping you serve your clients. And so what I want to do next, now that you know we've been identified as an essential service provider, is really segue into what are we doing to ensure business continuity for Doxim and that we can continue to operate and service you. I should probably highlight that as we've been working throughout this week and the prior week, we have been fully operational. And I'm very proud and pleased to say that today, as we got on our morning call and we went through the list of those that were in our facilities on our third shift and starting the morning, we were fully staffed. And I believe last night hit every one of our SLAs. So we are open for business and continuing to work and service you. Now, as I think about the last couple of weeks, which are really unprecedented in at least my lifetime here, we quickly enacted our business continuity plan, right? And so we immediately identified those individuals that can work from home and said, please do so. We had made the investments in all of our functions to provide our associates with laptops so we could service our software clients, process data remotely. Now, why did we go to remote? If we are going to service you as an essential service provider, we need to make certain that our associates are healthy, their families are healthy. And so that promptness of taking action as part of our business continuity plan to have what I would define as the non-essential employees, or non-essential to be in the office employees to do their job, we immediately isolated them and had them work from home. We immediately, in conjunction with rolling that out, asked our associates to self-monitor. We continue and started from day one to really take the necessary precautions and follow the safety guidelines established by the World Health Organization and Center for Disease Control. We know we needed to focus on reducing the spread of risk, not just as good citizens of our respective countries, states, and provinces, but really for the health of our associates, as we knew we were going to have multiple shifts, and as being deemed that essential services provider, to focus our time and energy first and foremost on our associates' health was going to be vital for our ability to continue to provide that set of services. So we implemented enhanced infection control practices, as you see here, handing out gloves, disinfectant spray, wiping down the equipment. We've actually delayed the starts of our shifts in our production centers. So prior to associates going home, they could wipe down the equipment and keep it clean. We've educated our staff on the importance of good hygiene. We felt that that was necessary, again, to keep our associates healthy and vital to our ability to, as a business, continue to provide those services. Now, when you look at what the World Health Organization has said, a big part of continuing to slow the spread of the disease and maintain a healthy workforce, social distancing. Big part of what we enacted immediately. As I said, we went to, if you can work from home, please work from home. So again, an example of highlighting how we are taking the direction from the CDC very seriously. We went with our associates that had to be in the office and looked at how they actually got to work. Several of our associates that live in major cities do use public transportation. We made a decision. You could say it's not exactly, quote unquote, 6 feet under social distancing, but we as an organization would pay for a taxi, an Uber, or a Lyft so they could get to work without being on the public subway or bus or any other type of public transportation that would have them, elbow to elbow with other individuals traveling to and from work. We've supported associates by allowing them paid time away from work. So we have in our operation, in our process, have asked our associates first and foremost to self-monitor. If you are experiencing any symptoms, if you are you get up in the morning and you don't feel good, please take your temperature. If you're running a fever, stay home. We are going to pay for that time away from work, right? So it starts with the self-monitoring. Now, we've also implemented where the associates have to come to work every day. We actually have the laser thermometers in our facilities. We're taking people's temperatures. We're asking them to fill out forms of any symptoms that they have. Again, we're doing this as part of what we believe is a best practice following the CDC's guidelines and ensuring our associates' health so we can continue to serve you and your respective organizations. And even more importantly, the clients you serve. Again, we consider ourselves a part of the business behind the business. Now, as we look at all that we're doing and talking to you about this at a very high level, we are doing our best and are focused on hitting each and every one of our SLAs. We contractually commit to those up front, but in these unprecedented times, it's going to be extremely difficult for myself to talk here, look anybody in the eye and say we will not miss an SLA. We meet as an organization, and we'll get into the governance every morning, talking about how we were staffed. How did we do versus our SLAs? How does our inventory look? We're doing all we can to ensure we do meet every SLA. We're coming up on a month end, a quarter end. When it comes to the print and distribution, this is our most critical and demanding time. We have implemented our programs to allow for redundancy from our various locations, of which we have several. We have 9 data centers and 4 print centers in the US, backup, a primary center in Canada, and a backup. We have implemented our own business continuity in our operation, and have also engaged our third party by calling an event. And so we have third parties standing by to assist us. So we know we're an essential provider, but we know there may be potential impact to us hitting the SLAs. If we see that we are running behind, you will hear from us about that. My team has been instructed internally to over-communicate, externally to over-communicate. And I would ask that if you have any questions on this call, we're opening it up to chat. After this call, do not hesitate to send an email, place a phone call. It is at this time that we should be over-communicating. So we are working to protect our associates by following the CDC's guidelines. Knock on wood, the masks, the gloves, the enhanced cleaning that we've asked from our service providers that clean our facilities, and what we've asked our own associates to do, quite frankly, has done a great job for us. And as the governments implement more stringent regulations, we are monitoring this and following those type of directions very closely. So now, from an oversight perspective, as we did declare, dare I say internally, a disaster, or really implemented our business continuity plan, our pandemic response is really governed by 3 levels. And it starts with myself and my senior team and how we're interacting with our board. We are a profitable company. We're able to pay our people. We're paying our bills. We need everybody to do their part. We're in this time of uncertainty. We need to get paid. We need to maintain that operational flow. And this is something that we are monitoring. But we come together as a team every morning at 9 a.m. to talk about the day ahead, the night we just went through. We have at the second level, let's call it a more tactical, strategic level steering committee that meets across all of our functions from a technical perspective, a software development perspective. We are continuing to develop software. We are continuing to work any type of issue or bug that may come up within our software. We've identified Stephen O'Doherty, our Chief Information and Chief Security Officer, and have added to his team a project lead, our Director of Information Security, to work with all of our functions to ensure we can maintain the levels of service that you are used to. And at the operational level, the business continuity management team is really looking at communicating anything that's going on. They know, pick up the phone, generate an email, call a meeting. It's all geared toward ensuring we are overly communicating within the 4 walls of Doxim. And as hopefully you have seen, we are erring on the side of over communicating with all of you. We kept our quarterly client update letter that you should have received just yesterday. We set up this call. We are going to put this call out every week, just to give you, even if it's a 5-minute touch base, or open it to Q&A, and you will continue to see us where it makes sense to communicate via the written form. We've asked our account managers to over communicate with you, pick up the phone and avail themselves to any questions, comments you have, or if there are concerns or any other ways we can help, we are standing by to do just that.
That's right, Mike. And I think you've said it very clearly that a critical component to supporting those on the call today, you, our customers, through these challenging times is really ensuring that you have the regular updates as to the status of your work with Doxim and any changes of events. So we will be sharing updates with you through a variety of methods, including website updates. So we have information on our pandemic response, as well as our BCP policies on the website, and we'll continue to update that with any new information. Email, often one of the fastest methods of sharing updates will be email. So I would just say that please make sure you're allowing emails from Doxim, Doxim Marketing, Doxim Customer Success into your organization, that they don't get filtered out, which happens, I'm sure, quite often with different organizations. As Mike mentioned, webinar updates. Like the webinar you're on today, we will periodically schedule live webinar updates so that we can have more personal interaction on updates. You should, as Mike mentioned, you should have already heard from your account executive or your customer success manager. So these are your key go-to people to get your questions answered from within the organization. And finally, please use success@doxim.com, the email address, where you can request any information, answers to your questions. However, I will say for technical support, please use your regular channels in the client services team, support@doxim.com. So with that, I'd like to thank you for joining us today. Short webinar, but we wanted to keep it short. Everybody's very, very busy. We do appreciate your time. I hope that we've been able to answer your questions and provide you the information that you need to help drive your business. I'll pass it over to you, Mike, for final words.
Yeah, Janet, thank you for coordinating this call with our clients. This was a very informal presentation, but one that we felt was necessary to get out so you understand, first and foremost, we are deemed an essential services provider. There actually have been clients that have sent in letters, signed letters, authorizing that or informing the authorities, if you will, that we are an essential services provider. And we have those letters in hand for our associates if they get stopped, should we go to some sort of checking, why are you out of the facility? Our associates have that information to enable them to continue to their place of work or home from their place of work. So we are deemed an essential service provider. I can assure you we are following the CDC's guidelines, working remotely where we can, gloves, masks, wiping down the facility, extra layers of cleaning from a disinfection perspective being conducted by our cleaning crews. We know how important we are to the success of you and your organizations to deliver. We take that very seriously, and we thank you for attending this call. We thank you for your business, and I do want to wish health and safety to all of you and your families. Thank you for the time today, and thoughts and prayers are with you all.
Thanks, Mike. So with that, we will conclude our webinar. I do see a couple of questions coming in. Actually, maybe Mike will just pause there for a quick sec. We will answer a couple of questions because we do have time.
Yep.
So, and the first question, I believe you actually just answered. The question was, as governments implement more strict regulations, how will your employees prove they can travel to work?
Yeah, so we have, for example, I think it was the state of Michigan came out with very specific guidelines as to what jobs were deemed essential. And they asked for written documentation to be provided from an organization's clients, where in effect the client base was deeming the service provider as just that, an essential service provider. Thank you all who have, even in advance of us asking, sent those letters. We have that. All of our associates have a letter in their possession. They have documentation as to what we're doing in terms of following the CDC guidelines. At this point, I can tell you, we have not had any issues that I am aware of anybody getting to and from work. And with all of that, I do want to reemphasize, we are screening all of our associates as they show up on the job for the multiple shifts as well, again, to ensure not only that they can get through if the authorities stop them, but again, to ensure that the broader base is healthy.
Great, thanks, Mike. We have another question. Are you still accepting new printing jobs? Will there be delays with sending out other print jobs?
So the answer is we are first and foremost focused on serving the clients we have and the business that you have contracted with us to do. We do have what I would define as difficult times or peak capacity times probably. When I say difficult, for us to manage anything new, if we're not aware of it coming as a new client on board or a new project, will we accept new print jobs where we have capacity in one of our centers? The answer is yes. But our focus is on clients first. And those of you that have contracted us to do the work, that's where our focus is.
Great, thanks, Mike. And the next two are more comments than questions. So one of the comments that came in says, our Doxim contacts, and excuse me if I say it wrong, but Andre Pappas and Sandy Bosmer are doing a great job supporting Intuition on our onboarding efforts. Thank you. So thank you for that comment. Our staff and our associates are very much focused on ensuring a high level of customer experience. So that is a great comment that you've shared with us. And then another question, thank you for this opportunity, or not question, sorry, comment. Thank you for this opportunity to get on a webinar. Real-time updates will be critical to supporting our operations.
Well,
So
let me just say this, guys. Thank you for the comments. And, we're a 500-person strong organization. You have a lot going on. But I can tell you that anytime we've gotten a thank you or a recognition, as normal course, we share those. But here, in the time where there's a lot of stress on people, you all are experiencing it on the job and at home and what have you. Those comments are so greatly appreciated. We immediately put them on our website. We have internal vehicles where we share this data. It really is, it's uplifting to me, quite frankly. And I feel a great sense of pride personally that we as an organization are focused on serving you and have been deemed, quite frankly, an essential service provider. And so I can assure you we are doing all we can to keep our people motivated, focused. They understand the sense of purpose that we have to serve you. And if you fire off a note like this and have the time or feel compelled that we've gone above and beyond in helping serve you here, those really will go a long way. So thank you for those comments.
Thanks, Mike. At that point, I think we will conclude our webinar today. Thank you, everybody, for joining, and have a safe and healthy day.